Hi there! Welcome back to Medsoc Talk Naya. In our last video, we introduced you to the field of medical sociology and why it matters in Nigeria. Today, we're diving deeper into one major issue that affects millions of Nigerians every day: poverty, and how it directly influences health outcomes in our communities. First, let's start with this simple question. What is poverty? Poverty is not just about having low income. It's about lacking basic necessities like food, clean water, decent housing, education, and most importantly, access to quality healthcare. In Nigeria today, a large percentage of the population lives below the poverty line, surviving on less than $2 a day. So, how does poverty affect health outcomes? Here are some key words. 1. Poor nutrition. Many low-income families in Nigeria struggle to afford balanced meals. This leads to malnutrition, stunted growth in children, weakened immune systems, and increased risk of diseases like kwashiorkor and anemia. 2. Limited access to healthcare. Hospitals and clinics cost money, and for poor families, even basic treatments can seem unaffordable. Many people delay treatment or avoid hospitals altogether, making small illnesses turn into serious, life-threatening conditions. 3. Poor living conditions. People living in poverty often stay in overcrowded, poorly ventilated, and unsanitary environments. These conditions expose them to diseases like malaria, cholera, typhoid, and tuberculosis. 4. Lack of health education. Many people in low-income communities don't have access to health information. They may not know the importance of immunization, prenatal care, or even basic hygiene practices like washing hands regularly. This increases the risk of preventable diseases spreading in these areas. 5. Stress and mental health. Let's not forget, living in poverty also takes a heavy toll on mental health. Constant financial stress, worrying about survival, and insecurity can lead to anxiety, depression, and even suicidal thoughts. Let's take a typical example. A woman in a rural community starts feeling sick, but because she can't afford transport fare or hospital fees, she stays at home, trying herbal remedies. By the time she finally gets to a hospital, the illness has worsened. Treatment becomes more expensive, and suddenly, sometimes, it's too late. This is not just about individual choices. Medical sociology helps us understand that poverty-related health problems are caused by larger social structures like unemployment, poor education systems, inadequate government health policies, and corruption. Closing call to action. Understanding how poverty affects health can help policymakers, NGOs, and health workers design better health interventions and social support programs. So, if you found this video informative, please like, comment, and subscribe to Medsoc Talk Naya. In our next video, we'll be talking about gender and health. Thank you for watching, and see you in the next one.